that and see where our conversation takes us this time. So I'm going to stop sharing. So Abul, would you like to share your screen and have your session, please?
Yeah, thank you so much, Dr. Mark, for inviting me to present the study that I conducted in earlier 2020. And I'm going to share the screen now. Is that visible now? Yeah, thank you so much. So the title of the presentation is "What does COVID-19 measures mean to those on low incomes in Bangladesh?" So basically, that is something about the lived experience, about the inequality and the power that the lower income people face in the urban area of Bangladesh. And before going to the presentation, I would like to introduce myself first. So, as you know, my name is Abul Kalam, and I comfortable to introduce myself as a medical anthropology, as I've been working in this sector over the last 7 and 8 years after my graduation in Bangladesh. Before going to the presentation, I would like to outline of my presentation that what I will be talking in the next few minutes. So I will start talking about the studies that I have conducted related to COVID-19 using the narrative methods, and the background of the method, background of the study that I'm going to present today, and its methodology. And then I will discuss about 4 very specific key measures of COVID-19 and their meaning to the people that I have worked with. And then finally, I'll have one discussion and conclusion section. After that, you will have the opportunity to ask a question to me so I can answer to those queries. So as you know, this is one of the studies that I conducted to understand the meaning of the COVID messages that have been disseminated from the very beginning of the pandemic to the lower income population in the urban setting. And then another study I conducted with supervision of Dr. Mark as the host of this seminar, and that is on the understanding the social drivers of antibiotic use during COVID-19 in Bangladesh, and we also put some recommendation how to reduce the use of antimicrobials for COVID-19. And then I had another study on understanding the behavioral perspective from the user point of view of why the people using antibiotics for their COVID and COVID-like symptoms. And another study I conducted was on the behavioral determinants of vaccine acceptance. And again, it was with the urban population because I was very focused to this particular population for research. So basically, the background of the current study is Bangladesh. You might aware that Bangladesh reported its first laboratory confirmed SARS-CoV virus on 8th March 2020. As part of responding mechanism, the government of Bangladesh started taking initiative by closing academic institutions first, like schools, colleges, and universities. And then on 26th of March, the government started a nationwide lockdown, and it was declared on 16th March. So the first phase of lockdown was from 20th March to 30th May. And from that time, the government announced the closure of all public and private offices, and except the emergency services, including hospitals, different restaurants, and drug stores. And then that is the first phase that I have talked about. And during the second phase, the government decided to revoke the lockdown or official holidays for running the economic wheels, as well as giving advice to general people to adopt new behavioral activity and join the job on 31st of May 22. So that means before May 31st, it was the lockdown phase 1, and then government decided to revoke all those restriction and asked its population to change their to adopt new behaviors. So that is the context that I conducted this research. And as you know, the methodology I used was qualitative, and the approach was narrative. And to collect the data, I conducted interviews with the people who are living in the slum, in the urban areas, and who are belong to low-income groups such as rickshaw puller, hawker, garment worker, day labor, and housemaid. Those particular group of population live in the urban slums areas mostly. So that's why I choose those particular group of population for data collection. And the interview setup, I conducted the interviews with the help from my research team over telephone. And as I mentioned, there are a lot of phases of restriction. And so we conducted this study in 2 phases. First phase during the lockdown phase, and then the second phase was during the time when government eased the restrictions after 31st May. So in 2 phases, I conducted in total 78 interviews. So before going to the results, I want to mention that this study was, I was not the only one who conducted this study. I had 3 other research assistants who helped me to conduct those interviews and also assist me in the analysis as well. So our first behavior that we examined was work from home. What does it mean to those lower income population in the urban settlement? The concept of work from home is more related to big corporations, banks, insurance companies, NGOs, or government employees who have an online network with ICT infrastructure at their home. Additionally, the nature of work is also important in this regard, because for example, if someone works in the bank, so maybe all of the bank employees cannot perform their work by staying at home. So it is also related to the nature of their work as well. In terms of lower income people, particularly the day laborers, rickshaw pullers, hawkers, garment workers, and the people who run their family by their daily income, it is very difficult for them to work from home, because other than their tools, they cannot earn the income. So there is no opportunity to work at home or from home like that work. For example, one of the garment worker was mentioned that I see a garment factory in Ashulia, that is a place near to Dhaka. So including machine, yarn, and cloth, everything located that factory. So basically, the way he worked, the machineries and the tools that are located in the garment factory, that is located in the garment factory, and how could I work from home? That means without those tools, how could he work from home? So similar narratives also observed among the rickshaw pullers, because a rickshaw puller cannot work by staying at home, because he needs a road to ride it. So another key message is self-isolation or quarantine. So it is another important key measures that government and other public health authorities asked to follow if someone has COVID-19 or COVID-like symptoms. So this is very established behavior that need to be followed to contain the virus. So this is something that is very inconsistent for the people who are living in a urban settlement, particularly living in a one compartment with shared toilet. So these behaviors are very appropriate for those people who have separate setup uh, uh, for performing the isolation or quarantining. For example, one of the respondent was saying that I was suffering from a cough and cold, which I discussed with the doctor over phone. She advised me to live in a separate room and use a separate toilet so that my family members cannot come into my contact. But how could I manage such arrangement as my children, wife, and I are living in a room and 6 families share a common toilet? It is impossible for me to stay separately. Allah knows better what would happen to us. So basically, given the situation, he did not have any option to follow those messages due to those structural problems that he was suffering. So all he wished to uh, ask Allah to save him or save that particular family. And another important message is to uh, follow or perform social distance to avoid the infection. So if people like the study population that I conducted the study with follow this social distance, then it is difficult for them to run their livelihoods. One example can be drawn from a barber who was mentioning that when I switch on the television, I always heard that we should maintain social or physical distance to avoid infection. I don't know if that works or not, but one thing I can understand is it is not possible for me to continue my profession if I follow this message. You know, I have to touch other people's hand, neck, ear, and mouth, or how could I do my job? The people who come to me to get service also know this. So social distancing does not match with me. So basically, this narrative was uh, recorded during the second phase when the government asked its population uh, to perform the regular activities or their works by maintaining social distance. So that is the reality of that particular barber who needs to have physical contact with his service seekers. And the last one about the distant education. As I mentioned earlier, the government has the first step the government took was shutdown of the academic institutions that includes primary schools, pre-primary schools, primary schools, secondary school, higher secondary schools, and the universities. So in regards to continue the education, the government asked all education institutions to offer distance education via television, Internet of Things, and video. So for the lower income people, it is difficult to access to education, to television, mobile phone, computer, internet, to have the distance education for their children. So one of the respondent was mentioning that my 2 young kids were going to a nearby private school. I was barely able to manage their educational cost then. So the way he was talking about it was the pre-pandemic situation, and now he is talking about the lockdown phase. During the lockdown, the schools were closed. But recently, the government has started schooling over television and online means. I do not have a television, nor a smartphone or a computer. Even I lost my job recently. It became impossible for me to buy them these technologies. As a result, my kids cannot attend to those lessons. I do not So that maybe there is a typo. I do not know when this pandemic will be over. I have to wait until then. So basically, all he can do is to wait to end this pandemic and send his two daughters, two kids to the school and then start the education again. So there is four specific discussion point that I have pointed out from this study. First of all is that there is a number of interlinked aspects of inequalities which make lower income people more vulnerable in terms of their health risk and livelihood. For example, the key messages that are very restricted to perform their livelihoods, and also the structural problems make them more vulnerable to the infection, because if someone has the infection or has COVID-like symptoms due to limitation of their residential facilities, there is a risk to spread the infection to other family members. So that means those people are more vulnerable in terms of their health and in terms of their livelihood. So it leads to amplified the twin burdens that one was on the existing, meaning the pre-pandemic inequality and poverty, and the pandemic-induced sudden economic shock that need to be accelerated by following those particular key messages that need to be adopted. So due to those key messages, their lives and their livelihood and income are vulnerable. And another important point is that while everyone has been facing the pandemic risk, the life challenges of the lockdowns have been felt most acutely by the poor, the vulnerable, those in the informal sector and without saving and safety nets. So basically, these are the realities of those people who are working in the informal sectors and are not included in the social safety nets that the government has been providing. And also those people, as I mentioned earlier, those people lives on their daily income. So they don't have savings. So it is very difficult for them to run their life and livelihood. And the one recommendation from this study can be drawn is that effective response to COVID-19 require attention to social inequality to increase the capacities of all to protect themselves and their families from the pandemic. Meaning, you cannot avoid to follow those messages to contain the virus. And again, those if those messages are followed appropriately, then the life and livelihood of those lower income population are at risk. So that the ultimate solution is to provide support to those people to reduce the inequality and also ensure their economic support during the crisis. So that is my presentation here. So if you have any question, then I'll happy to answer. Thank you so much.
Thank you very much, Kalam. Let's keep our questions to the end so we don't consume too much of the time we have together. So everyone, if you have questions, make notes. I've been making notes, and